Zantac, Nexium, Losec, Omeprazole, Infant's Friend, Domperidone, Gaviscon, Mylanta. There are so many different medications out there for treating reflux. But what is reflux? So what is reflux? Well, in adults it's pretty straightforward. It's that feeling of heartburn that we get when food comes up into our esophagus. In infants, it's a little bit more complicated. You see, there's a much wider variety of presentation. We can have right down to the silent reflux, where they'll sit there and just right the way to the other end of the spectrum, where the kid vomits up what appears to be their entire feed and redecorates your room in the process. And of course, there's everything in between as well. Now you see, there are two different types of reflux that can occur. There's a physiological version and a disease-based one. Now, in reflux disease or gastroesophageal reflux disease, there tends to be other manifestations outside of just the vomiting or the reflux. There may be irritability or poor weight gain or a lot of extending of the neck, or there may be respiratory-based symptoms such as pneumonia. And this is where it becomes quite tricky for medical management, because what is it? Is it physiological reflux with a side of irritability? Is it a more serious underlying condition such as interstitial pyloric stenosis? We have to rule out all these possibilities to come to the right conclusion. So where does this difficulty with medical management stem from? Well, the Royal Australasian College of Physicians, or the RACP, put out a list affectionately known as the Do Not Do list. And one of the items on this list was to not medicate children who have reflux. The reason behind this is the research is showing that there's not a lot of benefit to be had from taking that medication. And if there is a benefit to be had, then it's likely to be a different disease process going on. And then there's also a mild to moderate risk of developing side effects such as allergies or infections. You see, we use stomach acid for quite a bit. A couple of things being to fight off any invading bacteria. The acid just kills them. And secondly, we use it to help break down proteins. Now you see, proteins are typically longer chains, and the stomach acid helps to cleave them up into smaller, more usable bits. But when it's on its full chain and big signs like this, if it goes through into the other aspects of our intestine, it can activate our allergic responses. Now, when we get these allergic responses happening, this is when we start to see a lot of skin manifestations. We can end up with eczema or dry patches or dermatitis, or very frequently, cradle cap. So what else can be done? Well, let's have a review of the mechanics involved in this whole process. Firstly, when we eat food, it goes from our mouth, travels down our esophagus and reaches our stomach. This is very helpful because this is how we digest food. Now, the reverse of this process, when stomach content comes back up into the esophagus, this process is called reflux. If it goes from the esophagus back up to the mouth, this process is called regurgitation. And if it exits the mouth, this is now vomiting. This is not that useful when it comes to digesting food. So in order to keep that stomach content down, we have a very special muscle at the bottom of our esophagus, and it's called the lower esophageal sphincter. Now this sphincter is under the control of one particular nerve, the vagus nerve. Now, the vagus nerve is involved in a lot of processes around our body, from salivary stuff to regulating our heart rate to a lot of digestive function. But a recent study showed something very interesting. See, the vagus nerve itself is located at the very top of our spine here. And in a recent study, they found dysfunctions of the spine can actually reflect as dysfunction of that vagal nerve. They looked at what's called heart rate variability, and they were able to improve vagal function by improving cervical spine function. Now this is very interesting because in 2018, Dr. Braden Keel and myself, we had a paper published on this, and we looked at behaviors of children with indicators of vagal dysfunction, such as vomiting or reflux or regurgitation or coughing or choking or gagging. And we found that in kids with these indicators of vagal nerve dysfunction, 73% had dysfunctions in normal neck movement. Now, the area that this frequently happened was at the very top part of the neck, the occipito-atlantal joint. This joint is involved in looking up and looking down, or extension type behaviors. What was one of the behaviors associated with the disease process of reflux? Extension-based things. So is it possible that a little bit of a dysfunction at the top part of the neck there could create a little bit of irritability, could create some of this extension behavior, and could also influence vagal nerve activity that may present as vomiting or reflux? So is it possible then that chiropractic may be able to help your child with reflux? I can see a plausible mechanism behind how it could work, but the research backing this is limited. A recent systematic review by Edzard Ernst looked at all the chiropractic studies that have shown benefit for treating children with reflux. And while a lot of these studies did show benefit, his conclusion stated that they were not of high enough quality to make these statements. So this is another one that puts medical management into a tricky spot. Here we have high-level studies that show we shouldn't be medicating children with reflux. And then we've got other studies that show benefit, but they're of low quality. So this becomes another point of real confusion. So what can be done if you've got an infant with a bit of reflux going on? Well, some recommend keeping your baby propped up a little bit after a feed, and that way it makes sure stomach content stays down in the stomach. It's less likely to come back up again. Some recommend adequate burping after a feed as well to make sure that there aren't any air pockets going on inside the esophagus that may bring a little bit of food back up too. I like to address nutritional side of things and give some dietary advice to mothers, especially if we're breastfeeding, as this may influence some of those behaviours too. And if we're formula feeding, I do like to discuss which formulas are being used and see if there's a more viable alternative. But in the same way that medication has a trial of treatment, I feel a trial of therapy with a pediatric trained physiotherapist or osteopath or chiropractor is not unreasonable. Now look, there was a lot of information covered in today's video, and I've included a list of all the references down in the description below. So if you'd like any of these, please come into contact with me and I can provide them for you. And as always, if you have any questions, you can always ask Dr. Christian.